My name is Josh Kesterson. I'm a gynecologic oncologist, and I'm the medical director of the Department of Gynecologic Oncology. So what I do is I care for women who have gynecologic malignancies. This includes ovarian cancer, uterine cancer, cervical cancer, and vulvovaginal cancer. We specialize in the surgical treatment and also the chemotherapy treatment of those women. So I think that speaks to the true journey that these patients are going on from diagnosis to treatment, and that may involve surgery, chemotherapy, radiation, or a combination thereof. And as you can appreciate, that is a journey over time. It involves many physical interventions as well as emotional kind of roller coaster that goes along with being treated for cancer, from dealing with that diagnosis and requiring family support, requiring social network support, and then trying to work throughout what is an uncertain process a lot of times for these women, and trying to come up with the best possible outcome for them. So certainly a journey. And then, for the support piece, to really have a collaborative type of picture whereby we can work together to ensure the best outcome for these patients. So when we think about treatment for malignancy, we certainly worry about financial toxicity. And you can appreciate that anytime anybody is going to have significant interventions such as surgery, such as chemotherapy or radiation, this may require time away from work. This may require a decrease in one's functional status. And with that certainly is going to be impaired physical activity, and that may mean a lack of ability to work or even perform activities around the home for the interim while they're being treated. So we certainly worry about them losing that income or even losing that ability to kind of like help out around the house in a way that they normally did. So, we think about the toxicity as far as, the chemotherapy associated toxicity or surgery toxicity, but certainly at the forefront of patients' minds at times is the financial toxicity. How am I going to pay for all this? How am I going to continue to support my family? How am I going to continue to contribute? So I think any interventions in that regard can certainly be beneficial. So when we think about treating cancer, we want to treat not just the cancer, we want to treat the patient. And I think that involves a certain like wellness component to it. And beyond just trying to remove a tumor or trying to kill off tumor cells with chemotherapy or radiation, there's certainly a need to address the entire body. And so I think those integrative services are certainly integral to the patient's well-being, both short and long term. Genetic counseling is incredibly important because you're struggling not only with a new diagnosis of cancer, but also the potential genetic implications. We know that we do have some entities, whether it be ovarian cancer or uterine cancer, that have a genetic predisposition. So not only is that patient at risk, but also her family is at risk. And the only way we really are able to uncover that diagnosis is through genetic counseling. And that involves not only the counseling piece, but also the testing piece. So the reason that people are able to be treated as well as we can treat them right now is because we've done research, because we've done trials. And those are certainly associated with a cost, okay? And that's the cost of setting up the trial, monitoring patients following the trial, as well as the contributions of the patients to be in that trial. When we think about the patient, we want to treat them in the optimal way, and that's arrived at by randomized controlled clinical trials oftentimes, or phase 1, phase 2 clinical trials. But when we think about how we move the field forward, we certainly want to use each patient to better the outcome of other patients as well as themselves. When we think about what I do as a gynecologic oncologist, I treat women who have gynecologic malignancies. But what I'm really trying to do is improve their quality of life and their quantity of life. And in doing so, hopefully allow them to pursue the things that are legacy defining for them and provide meaning for them in their lives and their families' lives. And so any contributions that we can have toward that end, I think also contributes to that donor's legacy. And that's trying to make the world a better place for those around you, which I think is really powerful, really impactful, and certainly legacy forming.